Morning, everyone. I have seen a lot of posts, and quite rightly so, over the past couple of weeks about the new study by Oxford University, which was examining the impact of a wide range of workplace wellbeing interventions, such as stress resilience, mindfulness classes, wellbeing apps. And not a surprise that the research had found that almost none of those interventions had any statistically significant impact on employee well-being. I really wanted to explain to you why this was using the Our Minds Works framework, to also explain how you can get the biggest return on investment and where you should be focusing all your investment to get the impact that you need when it comes to improving mental health and well-being. So let me just share my screen. What I'm going to share here is the social ecological model for health behaviour change, which is the Bronfenbrenner model. It's been around since the 80s and has been used in health and social care since then. So decades of it being utilised. The World Health Organization use it. Public Health England use it for health behaviour change. And the Our Minds Work culture change progression model is integrated with this social ecological model. So what you can see from the model here is that the individual is in the center of those circles. And when we look to the left under the individual, an individual's mental health can be impacted by positive and negative things. Everything from that person's age, their sex, their gender, their genetics, their current health, their knowledge around mental health and well-being, even down to their beliefs and spirituality. Now, as you can see, if we just focus on the individual, there are lots of supporting mechanisms and supporting ecological areas that are missing. So what I'm going to use this for is we can look at it with regards to mental health in the workplace here, but then I'm also going to give you an example of how you can use it with any health behavior change to really show the impact of how just focusing on individuals doesn't work. And that's why we're seeing that report and those statistics. So if we have somebody struggling with their mental health and we just focus on them as an individual, what we're missing is the green section, is the impact of interpersonal, both positive and negative. So interpersonal connections between family and social supports may have a negative impact on that person's mental health, or it may be that they have a positive impact on that person's mental health and well-being as well. So being able to ensure that that individual is surrounded by positive impacts from family and social supports within their community is one of the most impactful areas that we can provide additional support through to benefit that individual's improvement for mental health. But then if we just focus on that, we're then also missing the organizational impacts as well. So within the purple circle there, you can see that organizational impacts, as we know, can be both positive and negative when it comes to the workplace. We also know that work-related stress is one of the biggest contributing factors for work-related ill health in the UK. It leads to burnout, it leads to psychological injuries, it leads to sickness absence, presenteeism, and people wanting to leave because this is a cultural issue. So we can change that by working on the organisational impacts to be more positive, tackling stigma, looking at people's roles, the demands, providing additional support, ensuring managers and leaders are creating and fostering cultures that care, can also have that additional impact on that individual, which is great. We're starting to build these layers of support and community there and positive impacts. But even then, we're missing the societal impacts as well. So when it comes to the societal impacts in the blue circle there, these are potentially, again, both positive and negative. Our home lives, are detrimental to our mental health just as much as they can be positive for our mental health. So if we're not also tackling things at home, like home life stresses, there may be a lack of access to services within society, which, we do actually know about. Social norms may be impacting our mental health of that individual there as well, the culture within our society, and the environment that we're living in as well. These may all have a very negative impact on that individual's mental health. So we have to also focus on making improvements in that area as well, to strengthen even more the impact on that individual's mental health positively. And then on the biggest circle outside there, which is policy. So policy covers everybody in the UK. So government policy is there for everyone, not just that one specific individual, which means it can have so much more of a bigger impact. So when it comes to policy, this is government policy around mental health, about suicide prevention. We also have policies within workplaces like employment law, HSE legislation to protect people's mental health and well-being as well. And we've got best practice that can sit in that policy level too. So what you can now see, if we're focusing on improving the individual's mental health through building resilience, through a well-being app, without impacting positively all of those other ecological environments that that person is centered around, we're not going to get that change. So to show you how this also works in any other health impacts as well, we can look at it using a different topic. So we could look at this with regards to problematic substance use. Yeah. Yes, an individual may get to that point where they're ready to make improvements, they're ready to change. And lots of individuals may take that decision on their own and be ready to go forward to into recovery. Now, that is a great starting point, but without the support of family impacts, without the support within a social community, within a recovery community, this may be very difficult and isolating on their own. Without the support of your organization, if you're in recovery and you need some specific time to take out for NA meetings or your recovery coaching sessions, you may need some additional support in work if you're particularly having a bad day and just feel like you're struggling a little bit. So within your organization, there are also ways that an organizational culture that fosters recovery-friendly workplaces can also impact that individual's recovery journey. Then we've got the societal impacts as well. Recovery is often a long journey and can be impacted by our home life stresses, any emotional stresses that are going on that may unfortunately lead to potential relapses, the culture that we're living in, the communities that we're living in. For many people, they often need to remove themselves from their communities, from friendship circles to sustain their recovery as well. And then we've got the policy on the outside as well. So this is about, what is the government doing? What services are being provided when it comes to policy for supporting people in recovery? I just hope that shows you a little bit around why it is so important not to just focus on the individual when it comes to any health behaviour change. And if you would like to know more about the Our Minds Work culture change progression model, which integrates this model for the biggest return on investment, the biggest impact for your people, please do get in touch.